Our fifth study, Fox 2018, examines VBAC rates among those who had their cesarean for arrest of descent in the second stage. This topic is especially close to my heart because 1/3 of primary cesareans are for labor arrest, so it impacts a lot of parents. Plus, ACOG's 2017 guidelines recommend using the VBAC calculator to estimate VBAC likelihood. But the predicted VBAC rate a VBAC calculator generates is significantly lower if a parent had a cesarean for arrest of descent. As this study states, parents with this history are often quoted VBAC success rates of 17 to 50%, which are quite low. So when I saw this study, my ears and heart perked up. It's another retrospective cohort of all parents from a single maternal fetal medicine practice from 2005 to 2017 with a singleton pregnancy and one prior cesarean for arrest of descent. 208 parents were included, 100 of which, 48.1%, planned a VBAC. 40.5% of the parents in this practice planned a VBAC, which is simultaneously relatively high in comparison to national numbers in the United States, but also relatively low considering ACOG's recommendations on who is a VBAC candidate. VBAC rates in the overall MFM population were 84%, which are a bit higher than what is normally quoted as 60 to 80% depending on factors. Women who had a VBAC were more likely to have a prior vaginal delivery greater than 24 weeks, were younger, and had fewer total prior cesareans. Consistent with other studies, those with a prior vaginal delivery had a higher VBAC rate, 91.8% versus 71.8%. The study did not find a significant connection between VBAC rates and maternal age, BMI, estimated fetal weight, induction of labor, or cervical dilation. The big takeaway points are directly from the study's conclusion. Quote, for women with a prior cesarean for arrest of descent motivated to deliver vaginally, VBAC success rates are higher than expected. Even among women with no prior vaginal deliveries, the success rate was 71.8%. This suggests that arrest of descent is mostly dependent on factors unique to each pregnancy and not due to an inadequate pelvis or recurrent conditions. Women with a prior cesarean for arrest of descent should not be discouraged from attempting a VBAC in a subsequent pregnancy due to the concerns about the likelihood of success, end quote. And I read this and I think that this information should be incorporated into every individual practice, hospital policy, and informed decision-making process. Many parents pregnant after cesarean for arrest of descent are advised that their VBAC odds are low, and parents listen to their providers. We have to let parents know that there are many factors that impact their VBAC labor, as is the case in any labor. Additionally, the circumstances that resulted in their arrest of descent cesarean are unlikely to repeat. Things like position of the baby, position of the birthing parent, as well as how they are feeling emotionally at the time can vary greatly from labor to labor and can result in someone having a cesarean for arrest of descent followed by a VBAC. This study also is great news for advocates working on midwifery legislation or regulations because some states reference a prior cesarean for arrest of descent as a reason to risk out a parent from an out-of-hospital VBAC.